Hello, beautiful people. Nice to come your way once again today. My name is IB, and I am the founder of a charity called Nneoma Foundation. And at Nneoma Foundation, what we do is that we provide free medicals for people who cannot afford medicals in the rural eastern states of Nigeria. Yeah, we've been talking about diabetes, but I want to just touch briefly on a pre-diabetic state, because people have been asking me, what does it mean to be pre-diabetic, and what do they need to do not to, degenerate and then go into type 2 diabetes. Well, pre-diabetic state is when you are at that crossroad. You are not diabetic and your blood sugar is not low enough. The range is not low enough for you to be out of the danger zone. So you're just like in between being diagnosed with type 2 diabetes and not being diabetic at all. So at that stage, normally, usually it's accidental finding. Maybe you go for a blood test, or your doctor has a reason to send you for fasting blood test, and then recognizes that your blood sugar level is not too high, not too low, but just somewhere in between. At that stage, your doctor will either start you on a medication for some time and then check your blood levels, blood sugar level where it is, to know whether to stop it or not. But you as an individual who has been told that, you are pre-diabetic, you also have a role to play in your own well-being and, your own health. And what are those roles that you have to play? One, that is the time to start exercising. Take up a hobby, walk, exercise. It doesn't have to be a strenuous exercise, but just be active. It's also time for you to check your weight, because obesity, we all know that obesity is one of the risk factors of type 2 diabetes. So check your weight, make sure that you're your weight is reasonable for your height and everything. There's something that is called BMI. Just check that your weight is reasonable for your height, your age, yeah. And then you eat healthy. Most of these fizzy drinks is not very healthy. Cut off sugar. Not cutting off sugar entirely, but just be reasonable in the portion of food you eat, the fizzy drinks and anything sugary that you consume. Just be reasonable about what you eat. Take care of your body, and then hopefully you'll be out of the danger zone. Bye. See you once more.